these organisms, there is a much different vulnerability in biology when it comes to comparing those that grow in the mouth versus those that grow in the laboratory. And that's an important point. Next. So here are the comparisons in the essential oils. They penetrate the biofilms, they extract some more material, they affect generation time, and they also affect most effective in preformed plaque because they penetrate. Chlorhexidine does penetrate. It also affects permeability. It's most effective on a clean tooth surface because it actually binds to the tooth surface, so it prevents the formation of plaque. But it's not as effective in preformed plaque because it doesn't penetrate as well as Listerine or essential oils. Next. So now the real topic of this is bacteremia, and just the introduction has taken a long time. But what you can see is that in the case of the early stages of understanding microbiology and periodontitis, there was a thought that periodontal disease led to death due to the invasion of bacteria into the bloodstream and due to bacteremia. Now, we needed to study this. So next slide. This is just not important, but it just shows a number of odontogenic bacteria or plaque organisms and their abilities. A lot of them, major bacteria, even though they may not be pathogenic in the oral cavity, when they move around, they have a lot of ability to cause problems. Next. This is just a simple diagram showing how bacteria can enter the bloodstream, either through the pulp, through a cavity, or through the gingival tissue, as we mentioned. Next slide. And now these are just triggering factors that could conceivably push bacteria into the connective tissue in the bloodstream. Chewing, oral hygiene, dental procedures, tooth extraction, any number of things can cause bacteremias to occur. We'll talk more about that next. So this is just a way in which we go about studying bacteremia, and the best way to do it is through blood culture, because what we're looking for is to understand organisms that have some viability. If we do this through DNA, all we know is the fragments of the cells are there. We don't know whether or not the viable cells are there. Next. This is just a diagrammatic representation of bacterial endocarditis and the fact that oral bacteria can be found in damaged heart valves, such as, in cases of mitral valve prolapse or rheumatic fever or any damaged heart valve. These organisms have the ability to adhere to valvular tissue. Next. So this is a first. Now, this is out of order more or less, because when I went to dental school, we had a protocol that said that if you had a patient with infective endocarditis, you needed to give antibiotics 2 days before, the day of, and 2 days after. And this is the first study that really demonstrated what antibiotics are capable of doing in the case of a bacteremia. So this is Franklin Lowy, who did this study in using Strep sanguis, which is an oral organism, in a rabbit model of endocarditis. And we'll show you this very rapidly. Next slide. So this is our model, rabbit. Next. Here's what you do. You put there's the heart. Next. You put a catheter in the heart. That damages the heart. Now you have a vulnerable heart. You inject into the bloodstream Strep sanguis. And in order to know, and this is something we do all the time, and good for Franklin Lowy for doing it, he labeled these organisms so he knew exactly what the organisms that he got from the bloodstream were, that they weren't something coming from something else. So he had a streptomycin-resistant group and a rifampicin resistant Strep sanguis, and he did the injection with the marked strains. Next. Next one. So, and what you see is in the case of the streptomycin-resistant inoculum, he gave them penicillin. In the case of the rifampicin-resistant, he did not. And then the rabbits were killed. Their cardiac valvular system was excised, and he measured both the bloodstream and what was in the heart tissue. Next. And what he showed was in the case of penicillin, the bacterial density after 5 minutes of inoculation was was completely diminished in the penicillin positive strain. So the question was, how did that happen? And in the next slide, what you see is that the most prominent feature that he found was that not that the bacteria were killed, but their ability to adhere to the valvular tissue was significantly reduced. So that's a big difference. It was not killing. So here's a demonstration of a different organism he used, which is Staph aureus, showing how it attached to endothelial tissue. And this is just an electron micrograph showing that. But what he was able to show is that in the case of giving penicillin, he was able to reduce the ability of these organisms to attach, and he was also able to increase their generation time. So there's the two features that enabled him to show that this antibiotic treatment, one treatment, had a sufficient and interesting reduction in the ability to cause both a bacteremia, not so much a bacteremia, but their ability to bind to damaged heart tissue. Next slide. So penicillin did not really kill, but the pretreatment caused a decrease in adherence. And the bacterial adherence, even showing that, he showed that if he pretreated the endothelium with lipoteichoic acid, it would block the adherence of the cells. And so his conclusion was that the penicillin was affecting the production of lipoteichoic acid. Next. So cell wall products. Now, that was interesting, but Malin Verney and Daniel Overholzer then conducted experiments to show that in a dentally applied situation, they could do something similar. So he, remember, injected this directly into the bloodstream. What they did was a little bit different. They used a rat model, next slide, and what they did was they put ligatures around the first molars to induce periodontal disease. 14 weeks later, when they did induce periodontal disease in the molars of rats, they inserted a catheter into the aorta, and as a result of that, they damaged the valve, and then they determined bacteremias and also damage to the heart. I think I see it, I'm running over time. So let's go to the next slide. So in the next slide. So basically the results of these experiments are pretty dramatic. And what they showed was with the use of amoxicillin, what they did was they did not affect attachment. And the growth of the organism was I'm sorry, they did not affect the growth of the organism, but they did affect its ability to attach to valvular tissue. Whereas in the case of erythromycin, they were able to kill the organism, but then when they stopped the antibiotic, the organism came back. And but in terms of their experimental model, erythromycin and amoxicillin were the same, but they had different mechanisms of action. But what they did show was that by inducing periodontal disease, extracting the tooth with trauma, they were able to show that they got a bacteremia and that there was only a need for one dose of antibiotics, and that was sufficient to reduce the damage, the bacteremia and the bacteria's ability to attach to damaged heart valves. Next. So so this is the results in the controls that did not have the penicillin virtually all the animals died. In the case of amoxicillin, very few of the animals died. I think the essence of this is I just need to wrap this up. So, unfortunately, the part that is most important is that in 2000, this is 1988. In 2007, the American Heart Association decided that there was no need for prophylactic antibiotics, even though the recommendations had changed to 1 hour before, because there was a 12-hour half-life of the antibiotic and it protected the individuals. They decided there wasn't any need. Now, what happened is, due to health insurance in England, they followed those directions and they found that over the next 8 or 9 years, they had a significant increase in infectious endocarditis as a result of following those directions, so that they now have resumed the idea of giving an antibiotic 1 hour before treatment. And that has helped in terms of reducing infectious endocarditis from invasive dental procedures. What I wanted to show and I didn't show was the fact that if you irrigate subgingivally with an antiseptic agent into a pocket, you could have an almost identical effect in reducing bacteremia and the ability of bacteria to adhere to damaged heart valves. So, if you don't mind, go to the last slide. I just want to thank everyone who was involved in this. Scott, you could just go to the last slide. Yeah, a lot of slides. I totally apologize. And I just want to thank the people at Columbia who helped with this, and then the people here at Rutgers who were extremely important in these studies: David, Ken, Helen, Cabalan, and Mike Barnett, and then industry sponsors who sponsored a lot of this research that is, I think, very profound relative to the effect of dental treatment on